As expected, Canada's new Pharmacare bill has been passed into law. The bill, introduced as part of a deal between the NDP and the minority Liberal government, aims to cover the costs of contraception and diabetes medications, a foundational step towards a publicly funded national Pharmacare program. The law became official on Thursday, October 10th, following approval from Parliament. It specifically targets insulin for diabetes patients and common forms of contraception. This initiative is expected to benefit 9 million Canadian women of reproductive age and aims to alleviate out-of-pocket expenses for those without a drug plan.
For the very first time in Canada, we have a Pharmacare legislation that has become law, and as a result of that, 3.5 million Canadians will have access to diabetic medication, and 9 million women will have access to contraceptives. That's a huge step forward in the journey of our publicly funded healthcare system. But of course, this is one big step that we have taken. Now the important work begins, as you mentioned in your introduction, which is to work with our provinces and territories to reach agreements with them so that these medications could be provided to Canadians in those provinces and territories. And that's the important work that we are embarking on now. We've already have an MOU signed with British Columbia. They are, of course, going through an election right now. So as soon as the election is done, we will resume that work with the government. But we are also starting and engaging in the conversations with other provinces and territories as well.
However, the bill does not come without controversy and challenges. The NDP, led by Jagmeet Singh, has withdrawn from its previous support deal with the Liberals, although it continues to push for rapid implementation of the Pharmacare program. Singh has urged the government to promptly negotiate agreements with provinces and territories, which are necessary to activate the program locally. Notably, Alberta and Quebec have expressed reservations, with intentions to opt out, citing concerns over federal overreach into provincial jurisdictions. Conservative leader Pierre Poilievre, opposing the plan, criticizes it as a radical single-payer system, promising to dismantle it should his party gain power. The Canadian Chamber of Commerce and other critics also argue that the Pharmacare model is costly and burdensome for taxpayers. Despite these challenges, British Columbia has already signed a Memorandum of Understanding with Ottawa, setting a precedent for other provinces. The federal government hopes to have agreements with all provinces by the spring of 2025. The financial implications of the bill are significant, with the parliamentary budget watchdog estimating an increase in federal spending by Canadian $1.9 billion over the next 5 years.